Hello friends, today we're going to talk about zinc, S-adenosylmethionine, fish oil, St. John's wort, and adaptogens. Zinc. Why you should take it? Zinc is an important mineral for general health, and it may influence mood and depression. Though zinc lacks a potent antidepressant effect, supplementation is known to increase the effectiveness of other antidepressant therapies and improve the mood of people that are not suffering from clinical depression. High doses of zinc are potentially dangerous and should be avoided, but the standard dose will improve mood while also working with other antidepressant agents to increase their effects. Some dietary minerals like chromium also have antidepressant properties. It's recommended to focus on zinc supplementation first, since fixing a zinc deficiency will safely provide a variety of beneficial health effects. Zinc can cause a copper deficiency over time, since it kickstarts the process of creating a protein called metallothionein, which binds to excess zinc while depleting copper. The extra zinc leaves the body as a waste product. This can happen after zinc superloading, but the dose is below or too low to pose this risk. How to take it? Zinc should be supplemented in the range of 25 to 30 milligrams of elemental zinc per day. Elemental zinc refers to the weight of zinc itself and excludes the weight of the compound it is supplemented with to help absorption. For example, consuming 230 milligrams of zinc gluconate means consuming 30 milligrams of elemental zinc. The label displays the elemental dosage, not the total dosage. Zinc should be taken with meals, since some people may experience nausea after supplementing zinc on an empty stomach. Do not pair zinc with minerals like calcium, magnesium, and iron in combined doses of 800 milligrams or more. Combining them at low doses is fine, but in high amounts the minerals will compete for absorption and limit the overall effectiveness of supplementation. Zinc is a form of essential mineral and immune booster. Its primary function is for general health. It has other functions such as antioxidant, anti-inflammatory, allergies, and immunity, and goes well with green tea, increases absorption. S-adenosylmethionine, SAMe. Why you should take it? S-adenosylmethionine, SAMe, is a compound that works with enzymes in the body in a process called methylation. Sometimes a molecule needs a methyl group to undergo a chemical reaction. SAMe provides that group and allows the reaction to proceed. Many of these reactions are involved in depression. SAMe has been found to have a potency similar to tricyclic antidepressants, TCAs, and it can also increase the benefits seen with selective serotonin reuptake inhibitor, SSRI therapy. This increase in benefits seen with SSRIs is normally considered a beneficial interaction, although a high enough dose of both supplements could cause a negative reaction. If you take antidepressants, consult with a medical professional before supplementing SAMe. Both trimethylglycine, betaine, and creatine monohydrate have been found to increase SAMe levels indirectly after supplementation. Preliminary evidence suggests creatine may have the same antidepressant effects SAMe does. If SAMe is too expensive, creatine and trimethylglycine are worth looking into instead. Creatine and trimethylglycine do not have negative interactions with serotonin-based medications. SAMe is recommended as a base supplement, despite the potential SSRI interaction, because it's effective and can be replaced by alternate supplements by people taking antidepressants. How to take it? The standard SAMe dose is 400 milligrams, taken 3 times a day, for a total daily dose of 1,200 milligrams. It may take up to 2 weeks for SAMe supplementation to have significant effects on the body. SAMe should be taken with meals, and its usage alongside pharmaceuticals should be initially cleared by a medical practitioner. To mimic SAMe's effects with creatine, take 2 to 5 grams once a day with a meal. This is the standard supplemental creatine dose. S-adenosylmethionine is a form of nootropic, joint health, and pseudo-vitamin. It has other functions such as mood. Fish oil. Why you should take it? Fish oil is often claimed to enhance cognition. However, it improves cognition reliably only in a few cases, such as when supplemented by people suffering from major depression. Fish oil does not provide any benefits for people with non-major depression or people not suffering from depression but looking to improve their mood. Studies suggest that treatment-resistant depression is associated with a lower concentration of fish oil, eicosapentaenoic acid, EPA, in the brain. Further research is needed to confirm this relationship. Fish oil supplementation may play a supporting role for the treatment of depression, and preliminary human evidence suggests it may also play a role in reducing anxiety. Fish oil should be considered as an option for people suffering from severe depressive disorders. Consult with a medical doctor before using fish oil as a supporting therapy. Fish oil should not be a major focus for people with minor depressive disorders. How to take it? Higher than normal doses are needed to supplement fish oil for EPA content and brain health. Approximately 1 gram of fish oil, taken once a day with a meal, will provide maximal benefits. People that consume fatty fish multiple times a week can supplement 500 milligrams of fish oil instead. Fish oil is a form of nootropic, aquatic, supplements derived from the sea exclusively, joint health and anti-inflammatory. Its primary function is antioxidant and anti-inflammatory. It has other functions such as bone and joint health, cognitive function, brain health, cardiovascular, general health, liver health, and detoxification. Goes well with vitamin E, milk thistle, curcumin, fucoxanthin, fenugreek oil, and green tea catechins. St. John's wort. Why you should take it? Hypericum perforatum, also known as St. John's wort, is one of the best researched herbal antidepressants. It may be comparable to pharmaceutical alternatives like tricyclic antidepressants, TCAs, and monoamine oxidase inhibitors, MOAIs. St. John's wort is recommended for people not using medication, but suffering from depressive symptoms. St. John's wort interacts negatively with many pharmaceuticals and can render birth control pills ineffective. Supplementation may not be beneficial for people suffering from major depressive disorder or for people not suffering from depression but looking to improve their mood. Since St. John's wort can increase serotonin signaling in the brain, it especially should not be taken with antidepressants like selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and monoamine oxidase inhibitors, MAOIs, to avoid the risk of overdose. How to take it? The standard dose for St. John's wort supplementation is in the range of 300 to 900 milligrams a day. Start with the low end of the dose and slowly increase until the desired effects are achieved. The most common maintained dose is 600 milligrams. The ideal herb-to-drug ratio of St. John's wort is 3 to 7 to 1, which means supplements should contain 3 to 6% hyperforin and 0.1 to 0.3% hypericin. Further research is needed to determine if St. John's wort should be taken at a specific time, though it is commonly supplemented with breakfast. Adaptogens. Why you should take it? Adaptogens are a class of compounds that desensitize the body to future stress. These herbs are most effective when supplemented by stressed people. Major symptoms of stress include acute depression, mood swings, and irritability. Since adaptogens fight stress, they play a supporting role in improving mood. There are many adaptogens, but only a few have the evidence to support their use as supplements. The best researched adaptogens are Rhodiola rosea and ashwagandha. Rhodiola rosea can prevent and relieve burnout induced by stress. Ashwagandha is well tested in athletes, and it may provide benefits for people suffering from social anxiety. Adaptogens are only effective if the symptoms of depression and irritability being treated stem from stress and anxiety. People that do not suffer from stress do not need to supplement adaptogens. Ashwagandha may also play a role in improving the effects of other anxiety-reducing agents. How to take it? Rhodiola rosea is supplemented through an extract called SHR5, a mixture of 3% rosavins and 1% saladroside. Rhodiola rosea can either be supplemented every day or as a precaution for an upcoming stressor, like a presentation at work. To prepare for a future stressor, take 500 milligrams of SHR5. To take Rhodiola rosea daily, take between 80 to 160 milligrams, preferably with a meal. Ashwagandha is supplemented through a dry root extract. The standard dose is 300 to 500 milligrams taken with breakfast. Supplementation at night may cause insomnia. I hope you enjoyed the video. We'll be back with more content. Goodbye.